wellnesscouch.com, streaming wellness into your lives.
Welcome to Nourishing the Mother, featuring your hosts Bridget Wood and Julie Tenner.
Hello and welcome to Nourishing the Mother. I'm Bridget Wood.
And I'm Julie Tenner. And before we crack into today's nourishment and health through pregnancy, which is hopefully, if you are considering pregnancy or pregnant currently, this is a bit of a go-to guide, we're hoping, of what we would consider in pregnancy building up towards being ready for birth in the most optimal way possible. We'd love to remind you to jump onto nourishingthemother.com.au, and on our homepage there is a Join Our Tribe little box for your email address and name. And once a week, we will send you a wrap-up of everything in Nourishing the Mother, all the links, all of the blurbs, so you can pick and choose what you would like to read or listen to some more on. And then occasionally we'll send you another email that's a toolkit or a musing or an awakening of ours that's quite personal, related to our lives or our kids or, our journeys, that may provide some extra wisdom for you as well. So if you would love to continue your learning and expand your version of tribe with us, then please jump on to nourishingthemother.com.au.
So this topic has come about because we've got a couple of people in our tribe who have been on quite the long journey to achieving pregnancy, and I thought this is such a relevant topic for them, where they're finding themselves, and of course so many in our tribe who are either thinking about pregnancy or pregnant currently, to really dive into some of the big questions around how to nourish yourself through pregnancy, and also who to put on your team to help you get the best outcome that you want for yourself based on what you're seeking, essentially. And it was funny, as I was sharing with this friend, I was thinking, God, I forgot how much I actually know around this topic, because it's been an area for me that I've wanted to be incredibly well read and researched and intentional about over, the last 4 or 5 years. And so I'm like sent her home with a pile of books, and I've got some DVDs waiting for her to pick up. And
well, let's just start there.
Yeah.
So what pile of books did you send her home with?
I sent her with well, I guess I said to her, you can either take this now or take it later, because I never know whether women are wanting to think about birth yet when they're first pregnant, or whether they're just simply wanting to look at the pregnancy. Because I know for some women it's all about get to 12 weeks and get to 20 weeks, then we'll sort of think about birth. However, one of my particular friends is looking at a home birth, and so for her, getting it set up and her intentions right is paramount in the beginning, because there's a lot of work practically and also emotionally around being ready for that kind of birth. So I sent her home with Rhea Dempsey's book, Birth with Confidence.
It's great.
Savvy Choices for Normal Birth. So Rhea is a childbirth educator who Jules has trained with. And is incredibly knowledgeable around the physiology of birth and the
pain dynamics.
Pain dynamics, and which I just find is fascinating.
I think she's the only strong voice that really is talking about let's get real about pain and how women deal with it in birth, psychological and physiological.
And she, in fact, she wrote a really great article for me on suburban sandcastles, which is it was about a year ago, and it's just doing the rounds again now. Like I keep getting he's getting
fantastic
shared. So hop on suburbansandcastles.com if you want to get a taste of what Rhea's all about.
Is that in a blog? So suburbansandcastles.com/blog.
Just go into blog or articles, whatever it is. It's in the articles from about July 2016. Because she's such a wealth of knowledge and wisdom.
She is.
Around birth and that pain dynamics thing, which is really important, I think, for women to read about and understand the system also. If you're looking for a hospital birth, the system in which you're birthing, and what normal birth looks like in that system versus what normal birth looks like physiologically. So that was a book I sent my friend home with. I also sent her home with Well-Adjusted Babies by Dr. Jen Floriani, which is another one of the kind of holistic health Bibles around.
So what did you want her to get out of that book?
I said to her, look, because this friend is also one who can be quite, and she's the first to admit it, likes to control things and can sometimes go too far down one particular garden path. So I said to her, don't take it all as
black and white.
Black and white. You have to do it this way, but look at it as a set of guidelines. And she's like, totally, I'm down with that. Because
so in terms of health and philosophy?
Philosophy also, and just in terms of particularly nutrition, because sometimes if you get so focused, I think, on nutrition in pregnancy and what you can and can't eat and have I nourished myself enough, there can be also a flip side of anxiety that comes with that. And that was not something that I wanted this particular friend to to breed within her, because I think that your first pregnancy already does enough of that without you having to intentionally start to read all the things and conflict all of the advice and start to do your head in. So I love Jen's book, and in fact I'd love to get Jen on the podcast because it's such a lovely holistic look at pregnancy and birth and nourishment and giving yourself permission to nourish and really care for yourself and for your baby. So that was another book that I gave her.
What does that mean to you, permission for you to nourish yourself in pregnancy?
Well, I think for particularly if you're a woman and you are perhaps working a busy corporate job or you've got lots and lots of demands put on you, it can be very easy to get sucked into the needing to show up kind of martyrdom around womanhood and needing to play at the level that perhaps you've always known yourself to play at. And so I think that book really gives reverence to the birthing woman and the mother and around taking stock of where you are in your life and being willing to lean into perhaps changing a few things so that you can concentrate on your own wellness. Which for women that looks different, whatever stage you're at, whether you're on your first pregnancy or your fourth pregnancy, in which case you certainly can't do it, I think, in some of the ways that Jen talks about in the book, because she talks a little, about kind of winding back at work and trying to, get a daily nap and things like that, which is just not always practical. Nor necessarily what every woman needs, but I think sometimes to be able to have that permission for some women is good.
Yeah, sometimes you just need the permission.
Yeah. So those were the two books. I think I've got other books, but they're on loan to other people, and I'm going to have to get back and I've got my little lending library going on.
Do you keep track of that? Because that's my problem. I lend them and then I forget about them.
I kind of write my name in it, but that's kind of then I forget. So
yeah, me too.
Yeah. So those were the books, and I think I gave her some other bits and pieces around birth, but yeah, it just got me thinking, because she had some questions around, what should I do nutritionally and what should I do, to prepare my body best for this baby. Yeah. And I talked to her about things like acupuncture and chiropractic for pregnancy care, but then I also thought...
Do you want to give you a wrap on that, though?
Yeah, sure. Okay, before I jump over to you. So, acupuncture's been a critical thing, I think, for me. I have loved that through my preconception and pregnancy journeys with both my kids, because what I love about acupuncture is that it works with the meridians of the body, so it works on an amazingly energetic level, and particularly with a practitioner who both Jules and I see, she's like I don't know how to even, she's like a birth goddess in terms of pregnancy.
She's such an old soul. I've seen acupuncturists before and none of them can do what she can do. No. Like, there's something pretty profound about her.
Yeah, and she tunes into your subconscious, essentially. Yeah. And the needles almost put themselves in, I think, on some level.
That's amazing. And even problems, like I had acupuncture with my first two pregnancies, and they didn't actually, as far as I can tell, do anything.
Okay.
And then I have had acupuncture with my second two pregnancies, and 100% I can, and I did, preconceptively and after my miscarriage as well, and 100% completely changed the way that my body functioned energetically and physiologically, and in turn the way that my babies responded internally to that.
Yeah.
And that is a genius.
Oh, absolutely.
Like, profound.
I had her on speed dial kind of when
She's another one we should interview, actually.
Yeah, it would be really great, actually.
Yeah.
Yeah, certainly, I think I spent 7 years or something in her care. So she was the person I called when I miscarried. She was the person I called when I found myself in hospital needing to be induced. She came into hospital to help my induction through acupuncture.
Yeah, and thank God now she's teaching other acupuncturists.
Yeah. Which makes it great for other people around Australia too who are listening, which we can certainly put details in the show notes around her work. But acupuncture was something that I think is really great in the first trimester, just to really help with, I don't know if this is the right term, but, stickiness, that idea of, the first trimester being a higher risk for miscarriage. So it's really about priming your subconscious and also your uterus and the life force within you to help hold the space for that baby. And it's also really great for any complications that come up, so perhaps around needing to turn the baby, and also just to really prime the body for birth. So in the final sort of 4 weeks, it's nice to have regular acupuncture too. Chiropractic I really like because there's a particular technique called the Webster technique, which is a manipulation of a women's pelvis to help the alignment of the pelvis make the baby pass through as easily as possible. So it's really kind of making sure that everything is in its best possible position to allow the baby to move through as naturally as it can. So that's worthwhile having through pregnancy too.
So what else did you tell your friend?
It was funny because I thought, I said to her, this is the first, yes, you've got the 2 lines and this is the beginning of parenthood. This is the beginning of surrender. This is the beginning of letting go, the beginning of learning how much you can't control. And so, yes, it's amazing. And yes, it's beautiful and so much anticipation. But in terms of talk about polarities, right? Like pregnancy teaches you those. It teaches you the incredible love and excitement and also the fear and the pain and the wondering and the what ifs and the who do I believe and the what do I trust.
And surrender is thrust upon you because it is your first experience of literally having no control over your physical body, which up until this point in time you've had total control over.
Yeah, and it totally brings into, whatever your relationship you have with your body, pregnancy puts that under the spotlight. So if you're highly sporty, then you might resent the pregnancy because you can't play the sport you wanted to play. If you're really, really regimented with your food, or with the way that your body looks, then your baby and your body's going to teach you that you can't be. And if you really enjoy, like Jules, being in your body and really loving on your body, then you're going to have potentially a pregnancy that's going to really challenge that, which is certainly what I know you've been feeling. So pregnancy brings up all of these relationships with our own bodies as well, which I don't know that traditionally Western approaches to pregnancy and birth hold reverence for at all. Which is also why I really feel strongly that having some holistic therapies to help you along the pregnancy journey are really paramount.
Creating a team around you ensures that you show up in the most optimal way possible. This concept of doing it on your own is you're only a Rhea. Do you know one of Rhea's quotes for birth? But I think it applies universally to any situation we find ourselves in when we're facing our greatest passions, right? What was your quote? Moving into the fire of our greatest passions, or something like that. Whatever you said, it was beautiful. Is your team. You are only as strong as your weakest link.
I love that.
And that quote stays in my head, and I can still hear her voice when she says it because it's so profound. It's such simple words and yet so profound. You are only as strong as your weakest link. Which
is always a conversation that I feel myself wanting to have, but I'm tentative about with women who are pregnant and facing birth, who are saying, oh yeah, I'm just having this person, or I'm just going to go to your midwifery, or, oh yeah, I've got my obstetrician. I think, yeah, but who's around you? Because that's key. And so this particular friend had said to me, what do I do? Like, do I worry about my private health cover? Do I just switch it back on? And I said, well, okay, if you're seeking a home birth, then don't bother about private cover. And she's like, oh, what would you do? And what would your choice be again? And it's a hard one.
How lovely to be asked, though.
Oh, it's beautiful.
Because that's a real invitation in, as opposed to you going, here's how you should do it.
Which I really avoid. My sister-in-law is pregnant at the moment, and I was so careful with the words that I said and what advice I gave her. Not much, because I think it's so much a woman's own prerogative how she journeys into that. And what she seeks, what she seeks to bring into her realm
and her readiness. You could say exactly the same thing to her, and if she's not there, she's not going to hear it.
And it's funny because I've kind of been sitting in the last few days, I've been thinking, do I send her the links to our birth part 1 and 2, or do I just not? And I kind of feel like I just don't.
No, you don't,
because it's not. She
knows you've got that wisdom. If she wants it, she will seek it out.
And so even this particular friend, you'll love this, or not. Her obstetrician said to her, she doesn't recommend home birth for a first birth because you really need to prove yourself that you can birth first.
Wow.
Which I thought...
That's a fascinating concept.
Yeah, isn't it? Because I was saying to my friend, I was like, wow, so you put yourself in one of the most difficult environments in which to achieve a normal physiological birth. So it's kind of like a baptism of fire, where if you triumph, it's kind of like an anomaly, because the statistics are like 3% of women achieve physiological birth in hospital.
Yeah.
So physiological meaning no intervention whatsoever.
Yeah.
So I thought, gosh, and that's the paradigm. That's the paradigm essentially that women are looked upon. You need to prove you're okay to birth enough to have a home birth. But so often women go to home birth after they've had a challenging first experience and wanting something really different. So when she asked me what I would look to do, in setting up a team, I was explaining to her, well, if you're wanting to have a home birth, you need to look for a private midwife. But they're likely not going to engage you much before 12 weeks, but
you can go and interview with them.
Yeah, meet and see who you resonate with,
which is really important. I actually do think it's important to meet a couple of independent midwives at least,
because they all have such a different energy, and that's what you're looking for. If you're looking for the really maternal one who's going to mother you, or you're wanting somebody who's a bit more off in the corner knitting kind of.
Or who is more medically cautious.
Yeah.
So there's a huge spectrum.
There really
and you've got to find the midwife that matches your needs.
But I said to her, you're in a great position because you know what kind of care you want. So it's simply about finding the midwife that you resonate most with, and then you can simply massage it however you want it to go. You may find at some point that you're not comfortable and have it at home, in which case you can take that same midwife if you built an amazing relationship with and move into a hospital environment.
That's right.
And that's what's so fantastic. So I said, for me, I'd be looking for a private midwife and a doula, and that would be my team.
Yeah.
And then supported by, along the way, my own holistic health needs, so the chiro, the acupuncture, and then we'll get on to the nutrition.
That's
from
beautiful
your perspective.
advice. How did she respond to that?
Yeah, she was really, really keen, I think, to get started. She's incredibly well-read and researched and spent a long time, years really preparing for this moment, and has learned so much. So I was, I think, largely confirming a lot of what she was already knew, and needed someone else, particularly, and this is what frustrates me and pains me so much, particularly after she'd gone to this doctor who'd said, you need to have this, you need to do this, and you need to do this, and already, even though she was so knowledgeable, was starting to question everything she'd known, because she was told she had to have this scan, and the home birth wasn't safe, and in that moment, in that split second, until she started to question again and trust herself, all of everything she'd ever known had gone out the window, because this person in this white coat who was trusted had said this.
But this is back to the point of you're only as strong as your weakest link. That's the point of having really strongly aligned and integrated voices around you, is to rebound. You can still find your own voice in that. You don't need to subordinate to anyone.
No.
But you want to make sure that what you end up choosing is an authentic choice for you, not out of fear or old patterning of needing to be the good girl.
Yeah, and then needing to toe the line, whatever that line is. So I'd love to throw over now to nutritionally and supplement-wise, what other things women can do to really prepare themselves, and what that means, because I think that there can be so much fear around, don't eat this food and don't eat that food, and also, is the baby going to get enough of the good stuff?
I get that completely. The way I always start this conversation, I suppose, is just to understand the physiology of the way that we're designed as women growing babies in a nutritional sense. And what I mean by that is our babies get first priority of everything. So whatever nutritional stores you already have, whatever nutritionally you are consuming, your baby gets first priority. Your body automatically diverts all of those required nutrients for growing a baby to the baby, and you as the mother get what's left over. So when we're looking at supplementing in pregnancy, we're looking at supplementing the mother because she's showing signs of deficiency, not because the baby is. Because what will happen is, if it's not already in your circulation or in your tissues or bioavailable or already in your diet, your body will literally pull it out of your bones and pull it out of your organs and give it to the baby.
Which is so interesting, because I wonder if that calls into question all of the tests and things like that that are done to pregnant women, which are used as a deductive reasoning to say that the baby might have something wrong with it, like gestational diabetes and things like that, because the mother might be showing certain things, but that doesn't necessarily mean that the baby is also not getting or lacking,
nutritionally, I think something like gestational diabetes or hypertension, you're still going to be dealing with an interplay of bloodstreams, so that's still sitting in a different category. But when we're talking purely on a biochemical nutritional basis, that's the way that works. It's why we see, you know, these incredibly emaciated third world country mothers who have the most bouncing, beautiful babies when they're born. And it's because those babies, or the body, literally will pull it out of that mother to give priority to create life. And so this is when we see deficiency signs in mother. This is why we post-pregnancy and beyond have issues with bone density and with organ function and with hormonal function and tissue density and muscle mass, is because if we hadn't already had it in our bodies or in our diet during pregnancy, it's been extracted out of us. So the way that I want to say this is just relax in terms of what your baby is or isn't getting, because it's largely, you know, the baby will be looked after. So you do the best you can and the baby will be looked after. It's paying attention to you and how you're feeling and your body that actually dictates kind of which way you take nutrition in pregnancy. I don't think that there's this, well, the baby requires X amount of iron and vitamin B and blah, blah, blah. I don't, as a practitioner, look at pregnancy nutritional healthcare that way. I'm looking at what is happening in this mother and where does that direct what she's lacking or needing. So the only other thing I'll add to this is nausea, so morning sickness, pregnancy nausea of any sort. And that's me and my story, and it is fucking brutal when you are feeling so sick and you've been vomiting. The very thought of putting a tablet down your throat makes you want to dry reach just even thinking about it, let alone doing it. So, you know, I've had in all of my pregnancies high aspirations of, you know, and I've seen with my first and second, I saw a naturopath, and in the end, I stopped because I couldn't actually put into my body the stuff that was prescribed because I was just so rottenly sick.
Oh my gosh.
And particularly with my first pregnancy, it was a pretty hardcore naturopath at that point. I was just plagued with anxiety and guilt about what I wasn't putting into my body for my baby. And now I realise what a load of rubbish that was. Excuse me, because I'm still sick, which is funny when we're talking about health and pregnancy. Because our bodies will always actually provide for the baby first. So if you're still humming along and feeling reasonably pretty good, you're doing okay, you know. Iron is probably the one nutrient that I do encourage women as much as they can to supplement on, because you are using such an extraordinary amount up. In general, most women I see now are deficient in vitamin D and iron. And zinc. So these tiny minerals that we don't kind of have the diet that supports, and the vitamin D, because we're the slap baby generation, and it worked so well that now we have no exposure to sun and therefore, you know, incredibly vitamin D deficient. So they're always the ones I definitely get checked for, and am looking at where we can supplement, but not at the expense of, oh my God, I put it down my throat and I'm spending the next half an hour in the toilet vomiting. No, like, we don't need to do that. And there's loads of philosophies and theories around morning sickness itself. So some say, no one knows, they're all theoretical. Some say it's a sign of a really strong pregnancy, that those hormones are really deeply entrenched in the body and strong. Some say it's a not generational, that's not the word, historical version of healthcare, that our bodies are mediating what we do and don't need by not allowing us to consume certain foods and allowing us to consume others, that in a way it's an innate a version of getting our nutritional needs met. Same thing with cravings. It's always interesting to pay attention to if you have particular cravings and working out what the nutritional need is under those, because you can then obviously supplement in different ways depending on what actually comes up with those. So I would just say I also am a big fan of getting lots of fats in pregnancy. So again, but good quality fats that have our fat-soluble vitamins in them, because it's our fat-soluble vitamins that generally we don't consume because we're not organ-eating people anymore, or grass-fed butter, dairy, milk people anymore.
Yeah.
And the fat-soluble vitamins are what will support and sustain a woman's hormonal system long after she's given birth. So I'm looking more at what I see in my practice as being, I suppose, causative of not coping well is when those steroidal hormones don't function well. And largely you can track that back to, and hence why we have these rise in paleo diet and so on and so forth, is these really dense fats. And in pregnancy, you'll find yourself craving that. So I definitely look at that in a diet. The other one that's quite interesting is salt. So we are also so accustomed still from the old adage of, 10, 20 years ago of the, low salt diet due to heart implications and health and so on and so forth. Now you can get excellent quality salt, right? You can get your pink salt, your Himalayan salt, your good quality sea salt, which in and of themselves are a multi-mineral supplement.
Yeah.
So the other interesting thing is that with morning sickness, salt can actually be the cause. So some women carry like salt flakes with them, and sometimes it's enough just to pop one on their tongue and the nausea kind of disappears with it. The other thing with salt is that salt holds fluid in the body. And in pregnancy, we're doubling the fluid, sometimes tripling the fluid that we have to hold in order to support double the blood volume, the amniotic fluid, the baby's fluids. Like we're doubling to tripling the amount of fluid we have to hold. And if we don't have salt enough in our body to hold that fluid in our tissues and in our cells and in our blood vessels, we can't. And that's when we also get sick and we get problems and so on and so forth.
Yeah.
So sodium you'll often get tested for in pregnancy anyway, but salt is another one just to be conscious of, but good quality mineral-based salt. So they're probably the main areas I go to. I'm looking more hormonally what's sustaining this woman and providing enough iron that hopefully she's not getting to the point of anemia, which can certainly happen by second or third trimester.
Yeah. The other thing to look at too is placenta encapsulation.
Yeah, yes.
Postpartum.
Great. Yes, definitely. Definitely. What do you want to say about that?
Well, I don't know, but I'm pretty sure on one of our podcasts, what did I say? Don't encapsulate your placenta at your peril.
Yes.
Something like that.
Yes.
Was that what I said?
I think it was something like that. Yeah,
because I just had I didn't do this for my first pregnancy, but with Sylvie I did, and like the vitality that
completely
I
different,
continued
isn't
to
it?
that I managed to achieve, amid that newborn haze was pretty amazing.
Yeah.
Just because of the nature of the fact that you're consuming all of the things that your body is missing, you are putting straight back in.
Yeah. Which is extraordinary because we're the only mammals that don't consume our placenta.
Yeah.
And yet the placenta itself is primed specific to you and your baby, like specifically has...
I still take one every now and again, and she's 10 months old.
They're actually amazing, like specifically, perfectly balanced and nutritionally aligned for your exact needs postpartum. Like it's incredible. You couldn't actually mix artificially a hormonal, a nutritional, a mineral complex like this, and yet here it is, and we toss it in the bin.
Gosh.
Like it just actually blows my mind because I'm the same. I didn't do it with my first. With my second, placenta encapsulation kind of wasn't big, or I wasn't aware, or it wasn't around for me at that point. So it was placenta smoothies and things back then. And I was like, no, I just can't do that.
That's a bit
and so I didn't.
Yep.
And then with my third, I had the placenta encapsulation, the same thing, like felt freaking amazing, like incredible. And I've organised to have my placenta encapsulated for my fourth as well. So I absolutely resonate with that. That 100%.
And I am so, anything that is going to support the incredible demands put on a new mother, and on supporting her so she can support her baby, I am all for.
Yes.
And I think the placenta encapsulation is a beautiful example of that.
Yeah, it really is.
So I really hope that this gives you a bit of an overview of the way that we view nourishing the woman and mother in pregnancy, and also that little postpartum piece as well, and that our personal stories and perspectives on the advice we would give is somewhat helpful to you in our tribe. And of course, if you've got any other questions, we'd love you them to send them our way. And so, yeah, to connect with you, Jules,
is thepleasurenutritionist.com.au.
Yep, to me, it's suburbansandcastles.com. And of course, if you want to connect with us at Nourishing the Mother, it's nourishingthemother.com.au. Nourishing the Mother on Facebook and Instagram. And thank you so much for listening this week. We love that we get to do what we do and that we have a beautiful tribe listening to us and commenting and connecting and being part of this whole peeling back of layers. So we'll see you next week when we continue to peel back the layers on your mothering journey.
This has been a production of TheWellnessCouch.com. Check us out on Facebook and join in the conversation on Facebook.com/TheWellnessCouch. Subscribe to each show on iTunes and check us out on Twitter. The Wellness Couch, streaming wellness into your lives. Whilst the Wellness Couch presenter endeavor to provide accurate and helpful information to their listeners, these podcasts cannot take into account individual circumstances and are not intended to be a substitute for health and medical advice from a qualified health professional. You should always seek the advice of a qualified health professional before acting on any of the information provided by any of the Wellness Couch podcasts.